Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today we have another quiz in gynecology. Please choose the one best response. Let us start with the first one. A 38-year-old woman had infrequent scanty menstruation. She is unable to conceive for 2 years. She is obese and has a prominent coarse hair over the face and breast area. She has recently been diagnosed as a diabetic. Her serum testosterone level is high. What is the most likely abnormality identified on her pelvic ultrasound scan? Again, a 38-year-old woman had infrequent scanty menstruation. She is unable to conceive for 2 years. She is obese and has a prominent coarse hair over the face and breast area. She has recently been diagnosed as a diabetic. Her serum testosterone level is high. What is the most likely abnormality identified on her pelvic ultrasound scan? A. A. Follicular cyst in ovary. B. Large cystic ovarian mass. C. Increased ovarian volume and the necklace appearance of follicles. D. Absent ovaries. E. Chocolate cyst. Please choose the one best response. Okay, the one best response here is C. Increased ovarian volume and the necklace appearance of follicles, and this is ultrasound sign of PCOS. This lady has hirsutism, she is obese, she has oligomenorrhea. So the one best response here is increased ovarian volume and the necklace appearance of follicles. Let us go to the next. A 39-year-old woman has noted a breast lesion for 3 months. There is an eczematous 1 centimeter diameter area on the skin of the right breast areola, but there is no palpable lump. Biopsy of the skin shows large cell at the dermal epidermal junction that stain positively for mucin. What is the most likely diagnosis? Again, a 39-year-old woman has noted a breast lesion for 3 months. There is an eczematous 1 centimeter diameter area on the skin of the right breast areola, but there is no palpable lump. Biopsy of the skin shows large cells at the dermal epidermal junction that stain positively for mucin. What is the most likely diagnosis? A. Acute mastitis. B. Fat necrosis. C. Metastatic carcinoma. D. Paget's disease of the breast. E. Basal cell carcinoma. Please choose the one best response. The one best response here is D. Paget's disease of the breast. Okay. Let us go to the next. An 8-year-old girl shows early sign of telarc, but there is absence of axillary hair and pubic hair. The plasma level of which of the following would most likely be elevated in this girl? Again, an 8-year-old girl shows early sign of telarc, but there is absence of axillary hair and pubic hair. The plasma level of which of the following would most likely be elevated in this girl? Okay. As regards this stem, this girl, 8 years, has a telarchy. Telarc means breast budding, development of the breast. But there is absent axillary hair and pubic hair. Okay? Okay. So the plasma level of which of the following would most likely be elevated in this girl? A. Dihydroepiandrosterone. B. Gonadotropin releasing hormone. C. Progesterone. D. Testosterone. E. Thyroxine. Please choose the one best response. The one best response here is B. Gonadotropin releasing hormone. Increase in pulse, rhythm, and amount of GnRH is the cause of this precocious puberty. Isolated one as in case of development of the breast or the lark. Next, a 39-year-old woman presented with secondary amenorrhea for 1 year. She noticed vaginal dryness and episodes of sweating by night. Laboratory investigation revealed FSH 55 international unit per liter, LH 40 international unit per liter, and prolactin 15 nanogram per milli. What is the most likely diagnosis? A. Hyperprolactinemia. B. Pituitary microadenoma. C. Premature menopause. D. PCOS, Polycystic ovarian syndrome. E. Thyrotoxicosis. Please choose the one best response. Okay, the one best response here is C. Premature menopause. The lady has symptoms of menopause like hot flashes, sweating, and also the lab indicating elevated FSH and LH. This is a case of premature menopause because she is 39-year-old, and this is not the normal age for menopause. Okay, so this is a premature menopause. Next, please. In a postmenopausal woman, the cutoff value for the endometrial thickness by transvaginal sonography is, again, in a postmenopausal woman, the cutoff value for endometrial thickness by transvaginal sonography is A. 1 mm, B. 4 mm, C. 7 mm, D. 10 mm, E. 15 mm. Please choose the one best response. The one best response here is B. 4 mm. In the past, it was 5 mm, the cutoff, but in most recent guidelines, it should be less than 4 mm. So the one best response here is B. 4 mm, according to recent guidelines. Okay? Let us go to the next. A 28-year-old woman had an abnormal pap smear. Biopsy of the cervix on microscopic examination shows a typical squamous epithelium along with chyliocytosis. Upon microscopic examination, which pathological feature suggests cervical malignancy? A. Basement membrane infiltration. B. Dysplastic cells. C. Inflammatory cell background. D. Perinuclear halo. E. Fat cells. Please choose the one best response. I think it is very easy. Yeah. The best one response here is A. Basement membrane infiltration. This is indicating an invasive malignancy here. Okay? Because NCIN, this plastic cell, shouldn't invade the basement membrane. So basement membrane is intact in case of CIN 1, 2, or 3. But in case of malignancy, cervical carcinoma, there is basement membrane infiltration. Let us go to the next. 16-year-old girl present with primary amenorrhea, non-developed pubic and axillary hair, and no breast development. Okay? Okay. Her FSH 26 international unit per liter, LH 22 international unit per liter, karyotype 45X0. What is the most likely diagnosis? A. Kalman syndrome. B. Turner syndrome. C. Batau syndrome. D. Androgen insensitivity syndrome. E. Edwards syndrome. Please choose the one best response. Of course, the one best response here is B. Turner syndrome. Yeah. Karyotyping is 45X0, so there is monosmy of one of the sex chromosomes. Okay. A 19-year-old female presented with a primary amenorrhea. She had well-developed breast, sparse pubic and axillary hairs, and blind ending vagina. What is the most likely diagnosis? A. Mullerian agenesis. B. Uterine hypoplasia. C. Hypothyroidism. D. Congenital adrenal hyperplasia. E. Androgen insensitivity syndrome. Please choose the one best response. Here, in this case, the breast is well developed and there is sparse, very little or no pubic and axillary hair. As regards genital tract, there is blind ending vagina. Okay, so what is the one best response here? The one best response here is E, androgen insensitivity syndrome, of course. Yeah. Next, please. A 27-year-old woman, nulli gravida, presented with secondary amenorrhea for 9 months. She had headache for the last 4 months. Laboratory investigation revealed the FSH 6 international unit per liter, LH 5 international unit per liter, prolactin 900 nanogram per milli. What is the most likely diagnosis? A. PCOS. B. Pituitary microadenoma. C. Kalman syndrome. D. Estrogen secreting ovarian tumor. E. Asherman syndrome. Please choose the one best response. Of course, here B is the one best response, pituitary microadenoma, because prolactin is very high here, 900 nanogram per ml. Okay? Okay. And of course, hyperprolactinemia presented by galactorrhea, infertility, nostalgia, and so on. Go to the next, please. A 31-year-old woman has been unable to conceive in the past 10 years. For the past 10 years. She has mild pelvic pain but regular menstrual cycles. Past history shows few visits to gynecologists for vaginal discharge. Her pap smear is normal. Her husband's sperm count is normal. What is the most likely diagnosis? A. Adenomyosis. B. Chronic cervicitis. C. Ovarian teratoma. D. Pelvic inflammatory disease. E. Submucous fibroid. Choose the one best response. Okay, the one best response here is D. Pelvic inflammatory disease. Why? She has a pelvic pain, chronic pelvic pain. Also, she has a history of recurrent vaginal discharge and visits to gynecologist due to this complaint. Okay? And also what is very important, she is unable to conceive for 10 years. So infertility 10 years, all these suggesting the pelvic inflammatory disease. This is the end of my quiz today. I hope it was clear enough. Okay, try to answer before me when you hear this video, and please tell me about your score in a comment. And if there is any difficult question, please write it in the comment. Okay, this is my box published on Amazon, textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology. Okay, everybody, my best wishes for all of you.